Good. Good afternoon. Today is Tuesday, March the 19th. This is the Public Health and Safety Committee meeting. I do detect a quorum with council members Nash, Gregg, Huffman, Bradford, Benton, myself, and Weiner. Oh, and Sepulveda. I apologize. Oh, and Prepty. Look at you guys. All right, look at us. We got 9. Okay, we have a little bit of legislation to go through, but before we do that, we did not have anyone sign up for public comment today. I do not see anyone in the gallery who is eager to speak publicly, but if you want to come to the podium, you're welcome to. I don't see anybody rushing, so we'll go ahead and move on. I do have a proposed consent agenda of basically everything except for item number 5. Does anybody have anything that they would like to have removed from the consent calendar or consent agenda? Okay, so I will go ahead and start with resolutions. Item number 1, RS 2024-305, Porterfield, Evans, and others approves Amendment 1 to a grant from the Tennessee Department of Finance and Administration to Metro, acting by and through the Office of Family Safety, to fund staffing positions to help manage the multidisciplinary needs of its clients. Item number 2, RS 2024-306, Porterfield, Evans, and Coupon accepts a grant from the Tennessee Department of Finance and Administration to the Metropolitan Nashville Police Department to mitigate the effects of a law enforcement emergency by reimbursing overtime costs associated with the Covenant tragedy. Item number 3, RS 2024-307, Porterfield, Evans, and Coupon accepts a donation of 2 trained police horses from the Community Foundation of Middle Tennessee for the Metropolitan Nashville Police Department Mounted Patrol to use for law enforcement duties. Item number 4, RS 2024-308, Porterfield, Evans, and Welsh approves Amendment 1 to a Victim of Crime Act VOCA grant from the Tennessee Department of Finance and Administration to the Metropolitan Nashville Police Department to fund additional staffing, enhance services, and serve more victims of crime. Item number 6. This is bills on second reading. This is BL 2024-260 by Coupon, provides for the designation of public property within specified areas of downtown Nashville as a temporary special event zone during the time period beginning at 6:00 a.m. on June 5th, 2024, and ending at midnight, 12 a.m. on June 10th, 2024, relative to the use of these areas in conjunction with the 2024 CMA Fest and related activities and events. Do I have a motion? Thank you. It's been moved and properly seconded. All those in favor? Anyone opposed? All right, so we recommend approval of these items, 9 in favor, 0 against, and 0 not voting. We'll go back to item number 5, and this is BL 2024-179, Porterfield, Toombs, Benedict, and others. Amends Section 2.44.115 of the Metropolitan Code of Laws to require reporting related to use of force by the Metropolitan Nashville Police Department. I do have a letter from the sponsor who is running late in traffic, and she would like to defer this legislation for 2 meetings without the amendment. Do we have a motion? All right, it's been moved and seconded. Do you have a question? Okay, hold on just a second. Councilmember Bradford, you're recognized.
Thank you. Question on kind of procedure when this gets deferred on the floor. Correct me if I'm wrong. Has this already been deferred once already? So if that's the case, one more deferral on this indefinite after this?
That's correct. You get 2 deferrals, and then on the 3rd deferral, it will be an indefinite deferral, which means it has to stay off of the agenda for a period no shorter than 60 days before being requested to be put back on the agenda.
Okay, thank you for that clarification.
Thank you for that question. Is it appropriate to go ahead and recognize Councilmember Porterfield? Okay, Councilmember Porterfield, we were just getting into your legislation, and let me recognize you in case you have information you'd like to share with the group.
Yes, thank you, Madam Chair. I am requesting for a 2-meeting deferral And I was requesting a deferral before moving the amendment. I've been working with MMPD and we have some language for an amendment that we're working on now, but we do have a couple of more tweaks that we need to make. However, we're very close to having an agreement, and the language that's in the amendment that was proposed by Councilmember Allen is already in the amendment that we are working on. So we're almost there. We just need a little bit more time. So I'm asking for a 2-meeting deferral so that we have time to just finish working on it.
Okay, thank you for that additional context.
Thank you.
We did have a motion and a second on the floor. All those in favor of a 2-meeting deferral, please say aye. Anyone opposed? Anyone not voting? All right. We recommend approval of a 2-meeting deferral. Okay. We're going to go ahead and, first of all, transition into our speaker. We do have April Calvin from the Office of Homeless Services who's going to share some information, and then I will give a couple of little things I wanted to update everybody on and see if anybody else who's here representing other departments has anything that they need to share with the group. And so with that, I am going to turn on the public podium and recognize April Calvin.
Thank you, Council Lady Erin Evans and all of the committee members. I do have paper copies of the presentation that's on the screen if you all would like. I think I have enough for everyone. Thank you. Thank you. So this is the ARPA funds. We always refer to it as the $50 million. $25 million went actually to MDHA, and $25 million actually went to my office. Typically, Mr. Bill Clendenning is here to report, but he's out, unfortunately, with an illness. How about that? Should not reveal his medical HIPAA stuff. With COVID, we started revealing everything, huh? So you'll see on the first page here, just some of the significant things that we've done within this month. Every month is different, and we see a lot of movement every month. On page 14 of this, you'll see that's where we actually have a breakdown of the spending, and there's been a significant movement there because of multiple factors: an uptick in supportive services, the interim gap housing, and then final reconciliation of the MDHA funds that actually, the other 25 million I was speaking of.
And April, can I interject? And I'm sorry, Director Calvin, you're welcome to come up here. The council staff did put your presentation on this PowerPoint slide. If you want to be able to refer to it so it shows on the screen, it's totally up to you.
What is the pleasure of the council?
Come on down. And I think I just turned that microphone on, so if you wouldn't mind testing it just to make sure. No.
There we go. I think we're ready. I will move this slide along. I actually made notes here on my paper. So, thank you again for having me. As I was mentioning, I do want to talk a little bit about the Housing First Conference. Council Lady Jenny Welch was the only representative there from Metro Council. Hopefully she was able to share some really good information with you all. We had a wonderful event with over 250 individuals. And out of those 250 individuals, Dr. Samson Barris, who is the originator or the founder of Housing First Concept, and then Trudy Hernandez from Dallas. Trudy and Dallas are doing some wonderful things. A lot of the things that we're doing here, except for already having community buy-in and everyone moving in the same direction, and rolling out her strategy and her data. She was able to talk about successes and challenges, which was exciting for us. Also, as a part of these funds, we are working with our Planning and Research Department, and they've actually started to do monitoring sessions for all of the agencies that receive the funding. The initial monitoring session is a virtual session where we explain what we're going to do, and then there's an on-site monitoring session. And it's been working out pretty well. Within the next week, we're also now, as the collaborative applicant, we're also going along with MDHA and helping with monitoring the COC agencies as well. Another thing that I would like to highlight in this report is, I guess we'll go to page, oh, I have this now. Here. On page 4 of your report, you'll see the interim gap housing, and those are the two agencies that's been solely responsible for helping to assist with some of our camp closure or housing surge data. And then Launchpad was recently brought online, which is the organization that provides services for youth and the LGBTQIA population. Out of those agencies, you'll see that we've served a total of 379 people utilizing that interim gap funding. And still there is a little bit less than, I guess, a third of the funds that's left to be utilized. Is the funding that was allocated to MDHA. Initially, there was 2 rounds, and then there was a final round. So you'll see on your report that out of those 3 rounds of funding, a total of $2 million were actually there was a request for a total of $20 million, and that happened before the November 2022 or 2023 deadline. And the board approved $16 million to create 102 affordable gap loan units that would be solely dedicated to those experiencing homelessness. And out of that, what was proposed was a total of 120 to be designed. So I think 102 out of 120 is really still great opportunity there. But the most important part is that funding also brings on a total of 810 other affordable gap or affordable units based on income, meaning that if someone experiencing homelessness actually has a voucher or something else that they can use to help offset that cost, then they will have access to those units as well. I like to always talk about the much larger number that's being impacted by this, not just the 102 that is solely dedicated for our office. You all probably approved last month for the remaining $7 million that was unobligated to go towards the Barnes Fund. These are the agencies that are actually providing the supportive services. And you'll see the awards and the services that they agreed to provide. Most times they're providing above and beyond that. Here's the numbers. Step Up on Second is serving a total of 100 individuals, and Mending Hearts is serving 62 individuals. And they're still taking referrals from us. This is just the initial, I believe this actually started on, I don't have a start date here, but this is just the initial amount. And of course, knowing that these funds will be deployed up until mid-2026. Housing First. And there's the funding, all of that information is in front of you. I would like to brag a little bit on our Low Barrier Housing Collective community and the Landlord Engagement Department at Metro Office of Homeless Services. Here you'll see there's 175 properties that are participating in this collective, and as of today at our team meeting, the announcement was made that there's now 186 properties that's providing housing and lowering their barriers, meaning that they are accepting people regardless of their background. They don't have to make 3 times the income, and they may not have the best credit score. So we just ask that they lower their barriers in order to be a part of our organization. Another thing that we're really excited about is there's a developer, Always Getting Better, AGB Realty, that has really dedicated his property to people experiencing homelessness, and we've been able to help with furnishing all of those units as well as they're coming online. This is the chart that I always like to monitor the most because it kind of shows where we are in the spending, which I feel as though we're right where we should be as far as the spend down and the actual ARPA funds. Let's see if there's anything else. I know last time we were here, there were questions on the encampment, and our Hannah Cornejo-Neal, our data guru, was able to break this information down per camp and per interim gap housing or housing placement that was able to assist the individuals. Out of 189 individuals, we are at 10% recidivism, meaning that only 10% in about 15 to 18 months, only about 10% have actually re-entered into homelessness, which are really great odds. We had a meeting earlier today with HUD in the mayor's office, and when I gave them that number in the hallway, they agreed. Those were really great odds. One thing that we don't talk about enough, but our council members that participate in our Homeless Planning Council have asked us to make sure to add this data here. We share about 4 pages of data with our Homeless Planning Council and with our COC monthly, and that's something that we've started adding to your report here. So out of the 379 people that were addressed in this report, a much larger number that I would like for us to always focus on would be the 1,919 people that were actually housed this year with using all of our community partners in this space. And that's it for me. Any questions?
Councilmember Huffman?
Thank you, Madam Chair. Just a quick question in regards to the overall population. I believe I know the answer to this, but I just want to confirm. Starting, especially in January, February, the number starts to go up a little bit higher than it normally does. I'm assuming that's due to the point in time count. Is that correct?
I would say, I'm not sure if there's a actual fact to that. Either it's the point in time count or the change in season or more outreach workers providing work out in the community at that time.
Okay. And one more question about that, and maybe another request for Hannah. I'm sorry, I always have requests for you. So would it be possible to break down by originating location? And really what I'm trying to get at is, where are folks coming from? Are they from the Middle Tennessee area? Are they migrating here from other parts of the country? I'm just very, very curious to that breakdown. Is that possible?
So to your first question, I'll say that we do see the numbers go up in the winter because people are accessing services more, particularly at winter shelter, at Metro, and at Room in the Inn. So a lot of that is just more clients coming inside, coming to access services than are in the summer. We do not currently have data in HMIS on where people are coming from, but we are going to start collecting that hopefully in the next few weeks so that in the future we can give you that. We did collect it on the point in time count in January, so when the point in time numbers come out, we'll be able to share that as well. Generally, studies show that most people who experience homelessness, I think around 80–85%, are experiencing it in their own communities where they were previously housed.
Yep, exactly. And that's what I'm driving at. It would be awesome to see that data as we're out in our communities talking to folks. We often are, we tend to dehumanize the unhoused population. And the argument that I always make is, these are your neighbors. You don't have to believe it because it's true. And to have that data would extremely be helpful in those arguments. So thank you.
How about other questions? So I guess one of the questions that I had, going back to the, we've covered kind of the interim gap housing, to your point, Director, because that was something that we voted on recently to send, that remaining money, the unencumbered funds over to the Barnes Fund. And Councilmember Suara is working on some additional conversation of, do we need to have legislation in place or what needs to happen to make sure that the criteria, that MDHA was using carries over, into the Barnes side. And I know you and I had a conversation specifically about the, kind of the support services and that side of the funding and really some of the interim solutions, like basically we're coming to a cliff, at the end of the year. And I know that the goal is to get those organizations where they're self-sufficient. And so can you update us on kind of where we are with that process? And, are there scenarios where they're not self-sufficient, and in the end, we've got people kind of in interim situations, that's not appropriately funded, or kind of what's the game plan, I guess, on that side?
So through our monitoring sessions, we're having those real conversations with each individual agency as well. You'll see here on page 5, the 2 agencies whose funds are due to come offline in October. The Salvation Army has actually applied for the capacity building grant, which would bridge some of that as well and take them a little bit further. Then I think that contract will go until December of 2025, which should be coming before you all in the upcoming months. There's about 4 to 5 agencies that applied for the capacity building grant. And then the Community Care Fellowship, they actually had two locations that actually came offline because maybe they meant for it to be a temporary location, or the organization or the location decided to go in a different direction. And so we're just trying to watch their spending as they're downsizing a little bit, wanting to make sure that their spending is still in alignment with this, and then looking for some bridge funding in our Metro budget that will help with either bringing those organizations back whole, or helping to mitigate as the organization funding is replenishing.
Okay, thank you. And I guess from your perspective, at what point, as you're having these conversations, I guess I just don't want us to be in a position where, hey, it's the end of October or beginning of October, and, all of a sudden we've got people that are, just kind of in a weird limbo. And I'm assuming you're making plans and have are organized around that.
Yes, we're watching it very closely.
Okay.
We're watching it very closely, and even having individual conversations with the agencies outside of the site visits and the monitoring. And part of that is a little bit of the onus is on them as well. They said they would have a sustainability plan, so we're asking to see their sustainability plan on top of what would be needed from us to help with bridging this.
Okay, very good. Thank you for that information. And then the other question that I had, actually, I've got 2 more. One of the questions I had was around the folks that are in kind of the interim housing situations. Like, what are the biggest barriers for them to be able to transition into permanent housing?
So you'll see on page, maybe on page 4, and definitely on page 15, the breakdowns. Maybe we'll go with page 15 here. And those are the breakdowns of each individual camp, and then also the numbers that still enrolled versus those that moved into permanent housing, and then those that returned to homelessness. And so we have kind of the tale of 2 different worlds here, with Community Care Fellowship being a retrofitted church setup so that people can live in those locations. And what some of the concerns there would be are lowering their barriers. These funds were designed to have lower barriers to move people into housing quickly, and then as a housing first approach, and then deploying all the services that they need in that environment. And what we've noticed there is they have a lot of exits, mainly due to some barriers that they have not lowered, or some things that may make the individuals not feel like they would want to remain in the program. And then for the Salvation Army, what we've noticed is they're staying there a lot longer than expected, and not wanting to leave the program, or maybe sometimes sabotaging their exits, or not having enough, all of their documents online in order to actually get voucher subsidies that may be ready, that may be available for them. So a little bit of two separate things. One's moving them out a little bit fast and may not be moving into permanent housing, and the other one, they're staying there a lot longer than expected. So we're watching both of these very closely, and we host weekly meetings with them. We go over their data, we go over their long stayers, we discuss concerns as it relates to those that exited back into homelessness, and everyone's aware of kind of, our stance on this. And as a Housing First community, we're just watching the data and reviewing the data regularly.
Okay, thank you very much. And then the last question I had for you was, I saw that Pastor Jay Voorhees recently announced that he's moving to Vermont. And so what does that mean for Community Care Fellowship and the location that he has been operating and serving Nashville?
So my office is scheduling a meeting with him individually, just the assistant director and myself, so that we can have that conversation with him. I believe that there's MOUs in place already, and funding that was designated, and I'm not sure who his replacement will be, but those are conversations that will be had in the upcoming weeks.
Okay, very good. Thank you. How about any other questions from the committee? Seeing none, I really appreciate your time, and thank you for coming and sharing a little bit longer than you normally are afforded the opportunity to in a regular meeting. I appreciate it.
Thank you all for the opportunity.
Okay, we're going to open it up in the back. Are there any departments that have anything you need to share with the committee? I'm seeing at least Deputy Chief Gilder is shaking his head no. Anybody else? Oh, you do? Okay, come on down to the podium.
Podium, right? Okay.
Yes, ma'am.
Hello, everyone. My name is LaToya Townsend, and I am with the Metro Office of Family Safety. And I just wanted to take a quick moment to thank the Public Health and Safety Committee for all of your support of our office. Today, we celebrated 5 years of the Family Safety Center being opening. And so I just would be remiss if I didn't thank you all for the support you have provided us over these years. Without that support, we wouldn't be having a 5-year anniversary because we wouldn't have the center. So this is only a thank you.
Thank you very much. It was an awesome event. You guys did an amazing job. And
Thank you.
as well organized as that entire space is and everything that you all do, your event was equally as well organized, and I learned a lot, and it was good. So thank you for inviting us.
Thank you. Thank you.
Yes. How about any other departments that would like to share anything with the committee? Okay. Then I've got a couple quick things, and my number one thing was congratulating the Office of Family Safety, and we have had that conversation. Also wanted to mention, of course, thanks to Director Stephen Martini for his invitation to us to the Emergency Communications Center. I had a chance to go. If you haven't been, it's really worthwhile. Very good to see exactly what our 911 operators and dispatchers are doing. I have invited the Metro Action Commission to come to the committee and do a presentation. Director Crooms let me know today that they've got a 5-year federal review coming up in April, so they're going to have to look for a May date, so they'll be a little bit delayed. We'll be hearing from MNPD potentially the second meeting of April, doing an LPR pilot program overview, in particular for first-termers that may not have followed along with our conversations about the pilot, so that way we'll have an opportunity to get an update there. Of course, the search continues for Riley Strain, and there was a press conference that his family did today, and I know there's a lot of appreciation for all the first responders involved in that investigation, the business community, the regular community as part of their search, so I just wanted to recognize that. And then also wanted to bring your attention that there's a missing 15-year-old named Michael Webster, who's been missing since March the 5th here in Nashville. And he's been seen in the Napier-Sudicum community. And so if you know anybody in that area, there is actively residents looking for him and have been directed to give any contact information to MNPD's non-emergency number. So I wanted to mention that as well. If there's no other questions from the committee, then I will take a motion to adjourn. All right, we are adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.